Antes de presentar a nuestro próximo speaker, le agradecemos su participación en la organización de este evento a la revista Inversión Inmobiliaria.
Bienvenidos a este siguiente panel de Ciencias de la Vida, una perspectiva de competitividad global. Básicamente vamos a estar cubriendo una serie de temas porque la industria de Ciencias de la Vida se ha convertido, como saben, en una prioridad para muchas comunidades, siendo un motor de desarrollo en todo el mundo. El sector tiene un alto impacto a nivel de grandes inversiones en investigación, de trabajos bien remunerados, y también va creciendo en términos de innovación a una manera y un ritmo muy veloz. Con más de 30 años de experiencia a nivel mundial, tenemos hoy con nosotros a Bob Hess de Newmark Knight Frank, y quien explorará el panorama dentro de la industria, las oportunidades potenciales y los factores que impulsan la selección de sitios competitivos para esta industria. Voy a cambiarme a inglés para recibir a nuestros invitados globales. Bob, Alan, nice to see you. Welcome to our panel today. We are going to be handing over the conversation and the microphone to Alan Reeves, who is the Global Strategy Managing Director at Newmark, and then he will introduce Robert. We will have some questions at the end. Over to you, Alan.
Great, thank you, Renee. Well, I am very pleased to introduce you to my boss and our group's vice chairman, Robert, or Bob Hess. Bob heads up our global strategy group based out of Chicago. We have offices throughout the U.S., but Bob really leads that practice for us. Bob is very much a preeminent leader within the site selection community with over 30 years of experience. He's completed more than 250 actual projects and assignments across the globe, including in Latin America. Works across all industries, across all geographies, but really has a special focus within the life sciences. And Bob and I have been very active within this sector recently, both from a U.S. perspective and from a global perspective, and are really looking forward to bringing that perspective to you in the audience today. I could go on, but I really want to give more of the time to Bob to cover that. I will jump back in later and we can go through some other specifics, but Bob, over to you.
Thank you, Alan. And I'd like to say buenos dias and hello. And I'm looking forward to speaking with you all today from my home office in Chicago. I've been in my home office since March 12th. I've been in a plane a few times. I typically fly about 200,000 miles in the air every year, working with my clients across the globe on projects certainly related to many industries, but certainly life science. And I hope to bring all that experience from my past to the table today. We have quite a bit of information. There'll be a presentation coming up here in a second. I'm looking forward to sharing that. The title is called Life Sciences, a Global Competitiveness Perspective. And if you could bring up the slides, that would be great. I was actually scheduled to be in Amsterdam the next few days at the World Bio Conference. And certainly that's been canceled. So I'm glad I can actually be here speaking with you all about the life science industry. So if we could bring up the presentation, that would be great. Thank you very much. Hopefully the blue comes through. So if you go on to the next slide, and we'll be sending this presentation out to everybody after the meeting if we can't see some of the fonts and things of that sort. We've prepared a lot of material for you, and I hope it'll help the audience. The perspective of obviously Costa Rica, but Latin America, but also across the globe. I'd like to start out with my presentation that you all remember that the human genome was mapped back in 2003. And after 2003, there were many global projects in biotechnology that came from that. My story is this was one of my first global biotechnology projects. It was called Project Magellan. It was a $500 million biologics and monoclonal antibodies production facility. I spent a lot of time in Basel, Switzerland. Of course, that's where Roche and Novartis are headquartered. They actually are headquartered across the river from each other, and they actually spy on each other with telescopes. Pretty amazing, the cluster over there. But this was a very large project, and I think it's really important if you can see it, some of the criteria, which was important for this project. Obviously, talent and being in an industry cluster and accessibility globally. The client asked us to look at 20 countries in 20 weeks. That included Latin America. We did look at Brazil. Brazil did not make the short list, but this project ended up in Singapore. And this was just an amazing project. And I remember the earlier speakers from the conference talking about total cost of ownership. This is an example of a project that looked at cost and non-cost factors. And it's an example of the projects that will continue to look globally. And again, biotechnology is a very global industry. This went on to look at fine chemicals in Wuhan, sterile fill finish and vaccines in Italy. So again, a very globalized industry, and competing in the industry involves many of these variables you see in the table on the right. Next slide. I also wanted to share with you that this is a personal issue. Life science is about saving lives, and this has been my secret weapon. I have two daughters that were born with a fatal genetic disease. I don't mind sharing that with you, but we've done many things to save their lives, and it's allowed me to travel across the globe and meet many scientists and go to many conferences and learn a lot about cell and gene therapy and look at cures. So again, this is the personal side of it. This is about saving lives, and so that's another part of my background. And then, of course, in Latin America, I'm sure there are certain rare diseases and components of that. I encourage everybody to work with those organizations and learn from them. So I certainly have, and I feel like I have a passion for life science like nobody in the world because it involves family, saving lives, and it's personal. Next slide. And so this is the practice that I'm working in. We do a lot of corporate site selection. You can go on to the next slide. It's one of our best practices. I work for a large global commercial real estate firm that has, we have resources all over the globe, and we leverage this platform. I've been to Costa Rica at least 5 times, personal and business, and I'm looking forward to talking more about how we perceive Costa Rica, this team here that you see, and how they understand Latin America, and how they understand competitiveness, and some of the factors that I think we can really focus on to make Costa Rica and Latin America more in the forefront of life science. Next slide. And these are some of our clients. I'd like to highlight a couple. When you talk about life science, I think people think about biotech and biosciences and pharmaceuticals, but they're also talking about companies like Indigo. You've probably heard of that company. That's in the agritech, agribio area. So life science transcends many different sectors. And we'll talk about that in a second. So excellent client base from red blood cells to early cancer detection. So we've been very involved with many, many different industries that are very localized within states, within countries, or industries that are looking at multiple countries and multiple ecosystems across the globe. Next slide. And these are our Latin America life science clients. We're pretty proud of this. It's developing. It's amazing what type of capability you already have in Latin America. And of course, where you're going to take that more so from an innovation side, R&D side, and I'll call all the whole issue around big data. Big data is making all of these companies rethink their entire life science platform. And that is a wonderful opportunity for Costa Rica, Mexico, Brazil, and other Latin American countries. We'll talk more about that. Next slide. And you can go on to the next slide. So the first thing that I want to talk about, what is the life science industry? And it's probably really hard to see that. Maybe it's a little fuzzy, but basically this is like a value print of the entire industry. And this goes from biosimilars on the top and therapeutics to agribio to respiratory devices. This is a complete map of all the segments that you should consider in Costa Rica and Latin America about where you could compete. So the question is, do you want to compete in all of these segments, from telehealth to delivery devices to proteomics to peptides to food sciences, nutraceuticals, even cosmetics are considered life science? So what is life science industry? Where are the jobs? You can see figures here for the US. It's 100,000 companies. In Latin America, it's roughly about $76 billion as an industry and growing at 8 to 11%. So there is a lot going on to understand. But the key message from this slide is, where do you want to compete? What are the segments? What's growing? And how do your assets map up against this entire value print for the life science industry? Next slide. And here's some of the questions that our clients are asking. They do ask about clusters and ecosystems all the time. By the way, when you look at the life science industry, there's like 4 components. One is grow your own. And I heard some earlier speakers today that were fantastic. Those are the best stories in the world to talk about what you've grown locally, and where you've seen tech transfer and universities and incubators come into play. And then, of course, that evolves next to more ecosystem development and pipeline and talent development and universities and new skills coming out of community colleges. Then, of course, that's going to move into attraction. So you've got this retention, entrepreneurship, attraction, and then all these questions evolve in site selection processes along from that. So mature clusters, emerging clusters. Where are the regions? These are questions are focused on U.S. areas, but you can put any Latin America in there also. They're going to ask where can they scale? Where can they have sustainable locations? Sustainability is a very important component of the life science industry. Obviously, they're always going to look at cost and labor and competition. One thing that a lot of life science companies look for is, what is their alternative career opportunities? So if there is medical devices in Costa Rica, and I know that's phenomenal what you have there. If you want to evolve from medical devices, what's the next industry that you develop or be employed in? So you got to think about that ecosystem, and I'll call it alternative career opportunities for the scientists, for the people, for the medical technology. Where can they evolve? Where can they grow? That should be part of the strategic development of the ecosystem. Next slide. And so where are the opportunities? Certainly, if you look at Latin America, Brazil and Mexico are the largest clusters. You've got Roche and Bayer and AstraZeneca, J&J, Novartis, Merck, the big companies in Brazil. I'm less aware of the small companies. There's a story to be told there. Who are the legacy players? Who are the unicorns? Who's emerging? Homegrown innovators. It's about telling your story, right? Is there venture capital across Latin America that can grow, be tapped into? Is that a region-wide collaborative effort on venture capital firms, developers, or is that more localized? So again, looking at this whole region, obviously Mexico and again, Brazil have the largest leaders, but again, Costa Rica is a powerhouse. So we'll talk about that later on in the whole medical device area and medical technologies. Next slide. So where's your opportunity in these sectors that we talked about, even COVID related? One of the things that we want to make, if you see that graph on the right, we're seeing most of the activity right now in terms of people with cash being invested in. People like from Jeff Bezos, the head of Amazon. He's investing in this sector. They're investing in these small startups and innovative companies that are putting new therapeutics and biologics and diagnostics and new technology in place. And they're growing through startup to growth to maturity. So that's a very important chart on the right, is to look at your Latin America profile and where does each country or does the region fall in its maturity curve, which I think if you've all been to business school or some people, you recognize that maturity curve. But it's a very important concept in terms of where you invest, early stage, late stage, developing your ecosystem, infrastructure, all those types of things that we look at in terms of where is the opportunity. And when we do those global searches, if you remember the previous case study in Novartis, they wanted to look at 20 countries in 20 weeks. 20 countries in 20 weeks. That was almost impossible. We did it. And so it's really important to be able to know thyself about where you and get that message out there, where you want to play in that maturity curve, and make sure you're in front of these global entities, which are buying some of the smaller companies. That's the other side of that, is M&A. We'll talk about that in a second. Next slide. So every client is unique. And here's some common themes, some more common themes. You can read these. I won't read them to you. But there's always questions and researchable problems. One thing going on right now, there's just so much growth in PPE, in certain types of diagnostics and therapeutics, of course, in response to COVID-19. The questions being asked, are we growing too quickly? Are we getting out in front of our skis? I guess that's a US terminology. Are we investing too much? Are we growing too fast? How do we put measured growth in place? Everybody wants to move fast for cures, saving lives. I certainly did in my personal life. I've been to no less than 20 international conferences with leading scientists talking about enzyme replacement therapy, gene therapy, vector integration. And I'll talk about CRISPR later on, which is an amazing new technology, looking for ways to save lives, save my daughter's lives. That's what's great about life science companies. They're purpose-driven, but they also have to run businesses, okay? And they're asking about business continuity and redundancy and savings and their real estate. So these are some common things we think about in terms of how the public sector can play into that thinking and answer these questions. So what drives these decisions? You go on to the next slide. What are the top 10 critical location factors? Now, you're going to have some speakers later today from other real estate firms. I think they're going to deep dive into a lot of these site selection factors. But here's the 10 that we're seeing. And, of course, talent is number one. Always will be. But it's just not about availability. It's about the sustainability of the talent, the innovation. The earlier speakers today were talking about the robust, I'll call it, type of talent to be able to have an aptitude to learn and to grow and evolve within the operation itself. It's a learning organization when you're in the life science industry. So that's going to go back to your schools and your education and your infrastructure in the area to learn about this industry and to make sure that you're really challenging people on problem solving and thinking about how to be that talent, that sustainable, innovative talent. Ecosystem alignment is really important. I'd like to use a United States example, if you allow me. Raleigh, North Carolina, RTP, you've probably heard of that. It's one of the most successful ecosystems in North America. But it took 30 years to develop that ecosystem from a concept 30 years ago to the powerhouse that it is now. There's a long journey and lots of change going throughout it. Real estate availability and flexibility, one thing that's important for Costa Rica and any country in Latin America right now is your real estate portfolio. Various sorts of labs, wet labs, BSL, ISO level, wet labs. Here in the United States, we cannot find any lab space that's available for plug and play. So there's the issue around developers and your real estate profile in a state in terms of where can you find that lab space? Where can you find validated facilities? And that's a really important thing, to these companies in terms of CapEx, timing, speed. We'll talk about that. And last thing to reinforce on this page, the others are pretty obvious, is tax structure. It's a very complicated industry in terms of where things are produced, where they're shipped, how they're taxed. And that's an important component of understanding where Costa Rica and Latin America play in, global tax strategy with these larger firms and the smaller firms as they evolve. Next slide. And then, of course, you'll have to look at these factors. This chart should have graphics with check marks and Harvey balls. For each of those industries on the left, there's going to be some that are mitigable and nice to have, neutrals and must haves in terms of how you would rank and score each of these areas of segmentation. Diagnostics and analytical services, digital healthcare and bioinformatics. You don't need a lot of site and buildings for that. So this is something for Costa Rica to look at. Look at these segments on the left and where you want to go, and then look at your assets across the top, and then score and rank them, weight them. So, for diagnostics and analytical services, cost is very important. Quality of life is important to all of them, maybe less so on medical distribution, right? So you got to think about the segmentations, the drivers, and then, of course, your asset mapping on what's driving the success in these industries. Next slide. A quick transition to offshoring of U.S. jobs, Asian jobs, to Latin America. Latin America is in the bullseye right now for reshoring and nearshoring. I think you've always been in the bullseye in Costa Rica. And I think the Invest in Costa Rica and Pilar and team do a great job. I just want to give them a call out. They do an excellent job positioning the country and the platform. But it is very competitive right now. And so this is something that it's like a carpe diem. I'll use that word. Something to take advantage of right now. There's lots of activity here. I won't say as strong as maybe I'd like to see it, but there is opportunity in PPE migrating. Well, I'll give you one example. Over 85% of all APIs, that's advanced pharmaceutical ingredients, have migrated to China over the last 20 to 30 years. One project I mentioned earlier in Wuhan was for Novartis, a fine chemicals plant. Migrating those back into the Americas is on the docket, but it's going to be very unique and it's going to be very competitive. So again, be thinking about what could be reshored from Asia. Where does Costa Rica, Central America, certainly Mexico fit into this relative to all the issues you see here? Trade tensions, national security, logistics, ports, airports, all these things are going to be evaluated. Next slide. And this is what they evaluate on the next page. We're doing feasibility studies for those firms right now. We are active in the sector, and they're going like, hey, I'm not sure. It's called China Plus One. They're not necessarily going to relocate all these industries from Asia to the U.S. or Canada or Latin America, but they have to investigate this. They have to investigate China Plus One strategies, okay? And all the boardrooms are asking, just take a look at the feasibility of this. And these are the factors that they look at. They look at labor availability, quality. So where are you in your training programs, in your workforce development in Costa Rica in terms of certain skill sets for certain segments that could reshore? Supply chain, a huge factor. Lead time. What about the cold chain? Cold chain is a very important component right now in terms of having vendors, things near the airport, facilities, understanding that component, and then, of course, infrastructure quality. So these are all the factors that are evaluated and quantified. If you go on to the next slide, and so you have to do a rapid location assessment. That's what we're doing right now. And we'll move on from this slide to the next slide. But keep in mind, this is a good time for Costa Rica or any country, Mexico, Brazil, to be looking at these industrial companies, looking at your industrial parks, talking with your economic development agencies, and making sure that you can evaluate these opportunities and stack them up, apples to apples in terms of comparisons. So back to the region. And I hope this is resonating with you. Next slide. Competing regionally or globally? This is a very important question. So are you competing Costa Rica with Mexico, with Brazil, with Argentina? We looked at Uruguay recently that was a BPO operation, but we saw some seeds of life science developing, and Chile has had some areas of technology related to this. So are you competing regionally or globally? Two different contexts, two different decision-making criterias, and also different approaches in terms of resources and the business case that you have to make. LATAM biotech firms, I see them primarily competing regionally. Do you have Roche and Novartis? By the way, they are in Central America, but are they looking at advancing their global operations in the area beyond shared services, back office, call centers, maybe certain types of medical device? Are they going to R&D is a very globalized industry, sterile fill finish, certain types of biochemicals, and all the segments. The most important slide in this presentation was the one up front when I showed you all the segments of life science. So where do you compete regionally and globally, okay? I mean, there's lots of competition even within your own region. So how do you evolve? Are you going to evolve upstream, downstream? And by the way, I think one of the biggest exciting parts of this industry is entrepreneurship in industry, growing your own. And I saw some examples earlier in the conference. We love those stories. If you can grow your own, that means you can compete regionally. And after that, you can compete globally. So it's an evolution in terms of how Costa Rica will fit into this competitive industry. I mean, pharmaceuticals are difficult. The cost is a big driver there. And of course, China and India and other countries have been very competitive at that. So is that next for Costa Rica? Again, it's back to what's the best fit moving forward. If you go on to the next slide, and these are some of your next competitors. And all of these areas have to look at research, universities, and institutions. Obviously, the talent access, free trade zones, large markets versus small markets, proximity to the U.S., very important. And then, of course, resources for different segments of that life science map that I talked about. So maybe you would disagree with the legacy leaders here in emerging contenders and the top tier and the on deck. But we were very surprised to see the amount of activity in all of these areas right now. And we're learning a lot about the life science market in Latin America. And I think this conference is spot on about creating that awareness and capability in all of these markets that are competing with each other also. Next slide. So the message here is, what's your badge? I guess the Spanish word for that is la insignia. What's your badge, Costa Rica? You can't have a badge in all of those segments, but where can you evolve upstream from R&D to manufacturing and development, obviously to sterile fill finish, distribution, different segments. There's a lot to be thinking about in terms of la insignia and where you focus your energy. And of course, one of your energy areas, next slide, is going to be in medical device. What a powerhouse. I mean, you all know this, but I don't think the world really realizes what a powerhouse Costa Rica is, in the medical devices. It's pretty amazing. And there's a lot to build on here because there's innovations going on in the supply chain for this industry. There's research and development on the effectiveness of titanium versus other rare metals used in, hip replacements and certain medical devices. So is that a connection to the rare minerals industry in Central America or Latin America? Rare minerals are a part of this. So that's about understanding the industries and the connection and the global supply chain and the gaps in the supply chain. So this is an exciting area, and I think there's much more to be done here in terms of looking at that upstream and downstream supply chain integration. Next slide. But there's some people out there that are making noise, and maybe you'll go scratch your head in this, like Puerto Rico. That's part of the United States, not Latin America. That's not how the Puerto Rico people are selling it. And that's not even how the leadership in the United States is going like, oh, let's look at Puerto Rico before we look at Central America. I called it noise. They're a bioscience powerhouse. But really? Peter Navarro says so. He tweeted, China fired, Puerto Rico hired recently in a tweet. And I'm not going to talk about tweets from our president, okay? I'll just leave it at that. But he's the director of trade and manufacturing policy. And so there's an ecosystem in place there that can evolve. So again, they're pushing cold chain, airports, free trade zone, their supply chain. Obviously, they have limited amount of talent and people. Automation, by the way, is going to impact things. So think about automation in the industries where maybe you need less people, or you're going to need higher skilled people. Can Puerto Rico evolve to that faster than Costa Rica? So I want to introduce automation into this also. So I'm calling it noise, but sometimes I think you got to get through Puerto Rico before you get to some of the Latin America countries or some U.S. companies, which I call very short-sighted thinking. I don't know how you say that in Spanish, short-sighted thinking. But again, that's something I wanted to make you aware of. And I think I brought up some of the challenges. Next slide. These are some of the challenges in Latin America, and I think globally for most countries. Obviously, government spending, regulatory bodies, and approvals of products, and commercialization, and the speed of that. Certainly, mergers and acquisitions. By the way, that is a good thing. If you look at most foreign direct investment data around the globe, everybody's thinking that's new greenfield or new investments in Costa Rica or Latin America. The majority of that is mergers and acquisition. So is there a mergers and acquisition component to your government outreach to make it easier from a regulatory standpoint or approvals? So that whole M&A area, I think, is a really window to opportunity across that value chain from drug discovery to commercialization. There's health system fragmentation here in the U.S. There is, I know, in Latin America. And one thing that I do want to mention, and I think the Spanish word is bienes races. That's real estate, right? CGMP facilities, validation. Again, I mentioned labs, having that real estate portfolio. If you have available real estate or you have developers in the area that understand that, that is a big competitive advantage in terms of if you have to look at 20 countries in 20 weeks, will you have facilities? Do you have vendors? Do you have developers that can really understand the specialized real estate that has to be developed? And it's very, very capital intensive, this industry. So these are some of the challenges to think about as you develop your next level strategy for Costa Rica, for all of Latin America in terms of being competitive in this value chain. A few more slides, and then we're going to get into questions. Next slide. Some things about Latin America that we've noticed. You have some of the most complete vaccination schemes in the world that are present in Latin America. I didn't know that. We were researching that. Costa Rica spends around 9% of its GDP in healthcare. It's about 17.7% in the United States. Mexico, maybe 6.5%. There are some new taxes in the region that are earmarked for healthcare, such as like sugary drinks tax in Mexico. I think there's some casino taxes in Mendoza, Argentina, and other things. You know what? You do need revenue sources for some of these challenges that I mentioned. I'm not sure if those are looked at positively or negatively, by investors, but that's really something we've noticed also. And then, of course, the clinical studies in the region are thriving, especially large healthcare systems that can provide great numbers of rare diseases. I will give you an example. I think that's very interesting. You have a certain genotype, you have demographics in Latin America that can serve for laboratories for certain diagnostics and therapeutics and things of that sort. I think most of the large companies that are in Latin America have discovered that, but it even could be a bigger part of your, I'll call it your development strategy for maybe more of the smaller emerging companies that look at therapeutics and biologics and all of these new efficacy systems differently that involve big data. And I do want to mention that. If you go on to the next slide. The project activity in this sector is really amazing. And what's common to 67% of all the site selectors, the global leading site selectors, mentioned biotech and life sciences as the industry of the future for the entire globe. This is not just the U.S., this is the entire area. What I wanted to look at is your connection between food and beverage processing, advanced manufacturing, and biotech and life sciences, and transportation and logistics. This is setting the stage very well for assets that get into this, all five of these industries, from big data, software and IT, IoT, to the logistics and supply chain side, to the food side, feeding the world's population. Better food, healthier food is part of biotech and life science. Advanced manufacturing like nutraceuticals. There's a lot of opportunity there to be thinking of. And some of the questions on the left, what we're hearing, they're asking questions about these industries and looking for connections. So I wanted to reinforce that relative to the previous slides about looking at these connections up and down the value chain. Next slide. And one of the last things I want to bring up is big data and digital. Now they're not talking about, terabytes. They're talking about petabytes. I mean, the amount of information that we could generate since we've mapped the human genome, this is a big part of the industry. So bioinformatics, big data, technology, digital, is that being developed alongside your programs in Latin America, in the countries, in Costa Rica, in the universities, in the schools, in Sao Paulo, in Mexico City, in Guadalajara, all of these cities that have major universities? It's a big part of life science. We just finished a project for a company that was a combination of healthcare, um, biotechnology, and big data. They did a lot of sequencing of all this information. They would get, blood samples for cancer detection from various groups all over the United States and soon the globe. And they would use these Illumina machines that could sequence and centrifuge all of this, and then we'd capture this data. And the output was not a drug, okay? It was a script. It was a piece of paper that actually did diagnostics on cancer detection, certain types of diseases. So everything's evolving relative to big data, digital, and how all these industries emerge and develop together. Next slide. So big question is, what do we do? There's so much there. Bob, you're just exposing so much to us. It's like, where do we focus? Where do we spend our time and resources? And I think that's what you're doing in this conference. If you go on to the next slide, where do you fit in? You have to think, next slide. Attraction, retention, innovation, tech transfer, entrepreneurship, the cloud, virtual IoT, programmatic topical issues that come up like COVID-19. I've seen that you have several companies in Latin America that are involved in the research for COVID-19 and contributing because it is a global supply chain. There are certain components that are rolling into R&D in San Francisco, working with a firm in Latin America that's going to be, working on Operation Warp Speed here in the United States. Those are great stories to get out there. I haven't seen those stories. I would push those stories out and your message about where Latin America is going in some of those very nuanced areas. So, and looking at manufacturing, customer patient, R&D and engineering, suppliers, where do you fit in that circle? And where do you fit in on attraction, retention, and that kind of like that balanced scorecard? I'm going to leave it at that. If you bring up the next slide, I'm not going to go over all our case studies, but we just finished one for a company called Rubius Therapeutics out of Boston. It was so wonderful to work for this company, some of the smartest scientists in the world. And what drove this, Boston in the United States, is a big generator of new therapies and new approaches. And of course, but when they have to manufacture at that, they typically don't do it, right there in Boston and Massachusetts. They'll either look next door, they'll look at ecosystems, or they'll look globally. So I'm assuming that the Latin America people in Costa Rica and other countries are spending time in Boston and in San Francisco and Zurich, Switzerland, looking at these companies and where they want to scale and stage next, because they come to us and say, hey, should we be local for lots of regions, or can we look at global operations now, or different types of configurations? This is what was important to them. R&D adjacency, certainly the talent and the workforce, operating costs all the time. And actually, they needed an existing building. So I want to reinforce that real estate strategy for your region. What's your portfolio? What's your real estate? Are there developers in Latin America, like Alexander in the United States, who is the top developer of life science space? And they're building spec lab space all across the United States. Who are those developers across Latin America that could become more part of your collaborative team in positioning the region's strengths and capabilities? So this is a great case study. And I guess I want to end on the last case study, the next one. We were so proud for Alan and Alan was asking me some questions. Next slide. To work for a company called Grail. Grail is out of San Francisco. We just helped them put a manufacturing facility in Raleigh, North Carolina. They have taken cancer detection to the next level. At a 98% confidence level, they can detect anywhere from, I think, Alan, 9 to 14 different cancer types early on, even before you would get the cancer, 10 or 20 years later. They're revolutionizing healthcare, cancer detection, diagnostics, and it was just a pleasure to work for these amazing people with their amazing purpose-driven organization. And guess who the investors are? Bill Gates and Jeff Bezos, two of the largest, and I think those folks too down there in Latin America. Are they? And getting those investors involved and seeing different options I think Grail at some point will be looking at Latin America. They're going to be looking at Asia when this capability continues to take off and actually becomes almost like a daily test we can do in our human resource benefits programs for companies, which they're looking at right now. So read up on Grail. And I think they even went IPO, and they might even be involved in an acquisition, M&A, right? So with that, I'm gonna leave it. If you just advance 2 slides, and then I'll be complete. I really appreciate you listening to us today. It was the next slide. It was my pleasure to share all this information. As you can see, I'm personally purposely driven about this industry. It has so much potential for Costa Rica and all of the Latin American countries. It's the storytelling, it's the segmentation. Where do you spend your time and resources? And how do you look at those challenges that we identified earlier and bring new players into the region to position yourself for success? So thank you for listening today. I think I'm almost like just 2 minutes over, and I appreciate your time and look forward to some questions. Yeah.
Thank you, Bob.
Thanks, Bob. That was great. Obviously, a lot of information and data to cover. You can't quite do it justice in just 30 minutes, so we appreciate you condensing it down to that session. I want to go back to a couple of comments you made, maybe just dig into some of those in a little bit more detail. You talked about technology and new technologies in the life science industry and how it's really advancing biotech in so many different ways. You mentioned CRISPR and the initial mapping of the human genome. Can you just talk a little bit more about that? What you've seen as a result of that, how it's really affected things, and maybe some things that companies are doing to really take advantage of that.
Well, I would encourage everybody to hop on the internet, look up Dr. Jennifer Doudna. She just won the Nobel Peace Prize in chemistry regarding CRISPR. She's from the University of California, Berkeley. And what CRISPR is, it's got limited potential. It's about scientists have been kind of like deleting or inserting genes into bacteria, since the late 90s and early 2000s. This is a new process. It essentially, that was kind of dirty in terms of like inserting genetic material into certain types of, genes. And now they can actually, it was like throwing a dart. Now they can actually do it perfectly in terms of attaching a vector or certain therapies onto a specific component of the cell. And it's just incredible what's going to happen with CRISPR, just like, mapping the human genome. And there's going to be a lot of cures and a lot of precise science and therapies and new diagnostic and capabilities that have come out of CRISPR. So the relevance there is what universities, what collaborations are in place to make sure those new technologies that come out of, like CRISPR, are brought into the platform across Latin America in gene therapy, cell therapy, stem cells, all those types of things, which are really the future of life science in many perspectives.
Great, thanks. And we are obviously a global real estate firm, so I do want to touch a little bit more on the real estate aspect of life sciences. Very unique type of requirements, really wide scope in regards to what companies are looking for. You touched on that in your comments, but can you talk a little bit more about how that really drives a project, the different things that companies think about, depending on what level of lab space they need, whether it's BSL1 all the way up to BSL3 or more, and just how that affects the overall process for companies, and how potentially Costa Rica can think about implementing some of those types of things to put themselves in a better position.
Yeah, great question, Alan. So at some point there has to be product. I mean, you have to land somewhere physically, and some elements to keep in mind. It might take up anywhere from 2 to 4 years to validate a CGMP manufacturing production operation. That's a long time, especially if you've come up with a new therapy or a cure or a program that you want to implement quickly. That's the big issue around COVID-19 right now, is we might be able to develop a vaccine, but where is it going to be produced and how's it going to be distributed to the population? So how do we get through that validation period? Well, that means you got to have facilities, almost spec buildings on the lab side, on the production side. And a good example, Alan, was our Grail project. What drove that project was existing facilities in North Carolina. That cut off years of the timeline in terms of creating the product. And now they're in the marketplace, you know, putting their cancer detection out there. If they had to develop a build-to-suit facility, some of these companies aren't in the real estate business. So they're looking for existing labs, wet labs, CGMP facilities, other types of real estate. That's been one of the biggest constraints I've seen in my career since I started this kind of life science work back in 2003, is finding compatible real estate with the timelines on the project.
No, those are great comments, Bob, and maybe just to add to that a little bit too, from what we've seen from a real estate search perspective is that Bob mentioned it, it's really difficult to find existing lab space, not just in the US, but from a global perspective. And once you start getting beyond, 50,000 square feet, it becomes even more difficult. There's only a handful of places in the really globe that can satisfy that type of need. So it really puts a community in a preeminent position if they have that type of existing asset in place.
Yeah,
Bob,
one comment on that. I think the universities can play a big role in that. So if you have, I forget the gentleman's name earlier, I saw the conference where you have an idea, you have wonderful talent, they're in Costa Rica and other countries, but they need an incubator space. That is a great investment, whether it's on a university campus or in a separate facility, whether it's public, private sector funded. Those 1 or 2 or 3 or 4 or 5 person startup firms, they need that space. And that is a wonderful investment. I would encourage you to find the money, the sources, find a philanthropist and put that initial space in place. It will be filled. It will be filled.
Absolutely. And I think we have time for one more question, Bob. And I think it just comes back to maybe the competition aspect of it. And you talked about Brazil and Mexico really leading the way in Latin America for life science investment. Though Costa Rica has seen its share and significant portion of that as well. When you look across the competitive landscape, I mean, is Costa Rica in a position to compete with the likes of Mexico and Brazil and other larger players? Or do they need to really focus in on those specific, like you said, talked about those segments where they really have the biggest strengths?
Well, first of all, Costa Rica has been competing globally for a long time. So the aptitude and the attitude is there, right? That's an exciting thing. And this conference is a great example of that. So now the question is what's next? I said, what's the badge, the La Insignia? So obviously you leverage off medical device and medical, the manufacturing side you have down there. But does that move into R&D, upstream and downstream? You've got to look at those segments. You've got to look at that one page in the report. I think, Alan, we had like 40 different segments there. Where an asset map against that and decide where do you start to catalyze some of those segments. By the way, there could be a gap in that whole supply chain in Latin America, and that's something that Costa Rica or other countries could take advantage of. So you really got to spend some time asset mapping, looking at that vertical and horizontal integration, picking your spots. And I don't know if there's anybody in here that has ever seen the game in the United States called Jeopardy, where you got to look at those segments and like, what are you going to bet on? Bioinformatics for $500, okay? It's not a game, but it's about like, it's a strategic bet about where you're going to play in that landscape. And I sounds like Costa Rica is going to take advantage of that, and this conference is one step closer to that competitive business case. It is about a business case. So thank you for letting me speak about that. And Alan, thank you for the great questions.
Absolutely. Well, I think that takes us to the end of our time. So Arena, I'll throw it back over to you.
Thank you. Thank you, both of you. Bob's presentation was certainly fascinating, giving us all this mapping of the opportunities we can as a country and as a region take advantage of. Muchísimas gracias a ambos, a Alan y a Robert, por sus brillantes intervenciones. Y antes de pasar a nuestro siguiente speaker, queremos agradecerle a los patrocinadores y dejarlos e invitarlos a ver el video de uno de ellos, de JLL. Los dejamos entonces con este video. Muchas gracias.